I believe the basic concept has not changed at all. It's all about communicating the brand benefit, and and it could be an ideal mixture of a rational and an emotional approach of giving a brand communication to the doctors. Maybe the channels have changed. Maybe the channels have changed. Maybe the branding is more often it is now, because you get a chance to actually do a bit of branding more often in terms of the visibility of the brand to the customers. I think that has changed. But the core, I don't think it has changed. And the core, I don't think it would also change. However, as the world, especially in the pharmaceutical industry, and the world is moving towards evidence-based medicine, earlier quite a bit used to be there on the features and benefits. Today, I think the communication is moving towards fairly statistically significant results, like what is known. I mean, even the clinical trials, if you have observed that, it's now a requirement to say that what is already available on this subject now, or on this subject, and what is new that this new clinical trial is going to add. And much more importance is being given to numbers needed to treat, and to make it very small, because I mean, the chance of you misinterpreting statistics is quite high. So, I mean, even those clinical trials have been talking about how to simplify it for a physician to understand the positive impact of these drugs and all that. So I think that is the change which the communications have come. Now it is more evidence-based. Now for everything that you mention, you have to mention a reference, and you cannot mention, or you cannot, these were there earlier also, but now they are much more stricter across the organizations, that you do not communicate without any references. I think that's something which is very good. What possibly still can continue to be better is always mention about the side effects and adverse drug interactions, and adverse effects and adverse and drug interactions possibly are the ones which may still have to come, and wherever caution needs to be exercised. This actually would improve the trust of the doctor for that brand. uh, I genuinely believe that you have to give a holistic picture of your brand. May not be every time. Every time it need not always be three positive benefits of the brand to the patient. I think that's what should be the future, because it creates kind of trust. Uh, every drug has got its own place in the therapy, and every pharmaceutical company has a right to place it for the right patient, position it, who will use it and why will they use it. Obviously, as simple as that kind of positioning, they all can do. But the brand communication, I believe, should be holistic, giving complete picture. Uh, the core has not changed, but the channels have changed, the modalities have changed, the frequency of communication has changed. But I genuinely believe it's still about being rational and being emotional. How is that ideal? A mixture of that depends on the kind of brand life cycle, the brand strategy, therapy area. All those things obviously would be there. And being a drug, obviously the emotional part is slightly less, and the rational part is always high in majority of our communications. The ratio might change slightly a bit here and there, because people do not remember numbers. People do remember the emotions quite well. So in the brand communications, I believe the core has not changed. It continues to be, I mean, as I have seen 30, 35 years back.